Check. Check, check. Check, check.
Good morning, everyone. Good morning. Welcome back to Public Health. It is really, really wonderful to see everybody here today. And we will begin our committee meeting process and convene our Public Health Committee meeting this morning. So just to start, welcome back to all of the members. I want to say a special welcome to Representative Amy Romano, who was a member of the committee officially at the end last year, but is now joining us for our committee meetings this year. So welcome, Representative Romano. I also would like to begin by just making sure that we all know one another. I think all of us who are legislators are well aware, and in fact, the people sitting around the room even more aware that it's the people behind the scenes who actually make this committee work and run. And so I'd like to just make sure we take a moment to do some introductions. First, of our longtime and amazing committee administrator, Beverly Henry, who is literally behind the scenes. We are so grateful for her and her service for so many years. And Senator Anwar wants to clap. I would love to clap for Beverly. So we also, this year, we have a new committee clerk. Diane Young-Rodney is joining us, and we welcome Diane to the committee. We have our assistant clerks, yes. And we will applaud all of you, but I'm going to ask you all to now hold your applause for the rest of the list. We have returning two wonderful longtime assistant clerks with us, Kathleen Panazza, the voice, as I call her, and those of you who have been to hearings know, as well as Dave Radcliffe, who's also behind the scenes as well. From the Legislative Commissioner's Office, we are very thankful to have returning Eileen Lawler-Parker, one of our attorneys who's here with us today, and Nick Panzarella, who is doing double duty this morning in another committee, also returning to the committee. We're very fortunate to have them, as well as James Orlando, who's here in the room, if you want to give a wave, James, and then Nicole Dubey, who is behind the scenes as well. Those two are our Office of Legislative Research attorneys. Again, we are very honored and grateful to have their support. We have David Kaplan, who is the Behavioral Health Oversight and MAPOC leader, administrator, and a lot of you see him in those meetings, and he also supports and provides assistance. And this year, the committee actually has an intern, and her name is Abigail Shaw. She's from Eastern Connecticut, so I hope that you all will welcome her and help her learn the ropes in public health. We will talk about next meeting dates and all that at the end. But before I turn it over to Senator Anwar, I just want to name and say that I'm really grateful for this committee and the kind of relationships we have here around this circle and in conversation. I know that we will be facing some pretty challenging issues in conversation this year. We are hearing from the Secretary at Appropriations as we speak, and we heard yesterday in the governor's budget some pretty significant changes to some of the agencies that we oversee, as well as some policy issues. I just thank you all for the kind of respect, appreciation, civil discourse, and ability to listen to one another that you have continued to show at this committee, and I know that we will continue to do the same this year as we work together. I feel grateful for the partnership with our ranking members, and I know as we have deeply held beliefs and passions, that we bring those ideas to the table in such a way that allows us to do this work productively. So with that, I will turn it over to my good co-chair, Senator Saud Anwar.
Thank you so much, Madam Co-Chair. Good morning, everyone. It's good to see all my colleagues again. This committee actually gets a lot of work done. If you can see even the first agenda it's a pretty robust agenda. We have a lot of things. This session is a very complex one. Every time we have a short session, the arguments that we have are not necessarily amongst one party or the other as much as they are about how are we going to survive this? How are we going to make this happen in the short time that we have and the limited funding options that we have? So our challenge is not policy and politics or any of those things as much as it's time and money. And that's what actually determines a lot of how things happen during this session. We have a very special committee because during the course of the public hearing, each and every one is emotionally impacted, listening to the stories and things that happen in the public health arena to people. And it's arguably one of the committees which is closest to the community with various policies, how they impact individuals. So that's the special part. So again, Representative Romano, welcome. And I just want to take a little moment to share one of our representatives who's no longer here with us, and Representative Kevin Ryan. And Representative Ryan served in this committee, and I was reading last year, since 1993. He was in this committee for some 32 years. And he served for 32 years, and from the moment he served, he was part of this committee. And his presence was a calming presence. His presence was a fun presence. He had a sense of humor that I have not come across anybody else in this building or around to see that. But the first 6 months, I was not sure if he was joking or he was not joking. But then I realized he was. And I said, oh, okay, good. But because it would take a little while for me to understand some of his jokes, but then when I got into it, it was just like I couldn't wait to see him. And, you know, a lot of the policies, and 32 years is a long time, he had his fingerprints in so many policies that when you'd really have a conversation, he would tell you it's which year, what was done. But he would not necessarily be out there telling people that he had a hand in so many good healthcare things that had happened in our state. And so he's going to be present in this committee through some of the work that we do. And he'll be missed for his physical presence. And I just feel that we are fortunate to have to work with so many gifted individuals throughout our work and service in this building here. So with that, Madam Co-Chair, back to you.
Thank you, Senator Anwar, and I so appreciate your remarks about Representative Ryan, as I feel like I want to cry, even as sometimes Rep. Ryan would make me want to cry. But I very, very much appreciate that, and we will absolutely miss him and his sense of humor and the depth of knowledge that he brought to the issues. Thank you very much. And after we hear from our ranking member, yes, we will have a moment of silence for Rep. Ryan. But first, I think Senator Summers, just so you all know, for the public listening in and everyone here, Senator Summers is over in appropriations right now. She serves as the ranking member. I know many of you who serve as leaders of committees and ranking members will also be juggling. So to those in the public watching, we are in and out all the time. And with that, I'm going to turn it over to our wonderful ranking member, Representative, I almost made you a senator, Clara DeStitria.
Thank you, Madam Co-Chair. Again, this is the second year of the best committee in the building. I want to thank my members for always being here, doing the hard work, and representing the people of your districts in the state of Connecticut. Thank you to my co-chairs for the hard work you always do. And as we've heard before, Senator, I almost made him a senator, Representative Ryan will be missed. He was a voice of reason, maybe sometimes not. I know Representative Carpino will especially miss him and the relationship that they had together, because I know she was very close to him. So again, thank you very much, and let's get to work.
Thank you. And before we do, if we could, and I know we will honor him in the chamber as well, but if we could just take a moment of silence remembering Representative Ryan. Thank you, everyone. So with that, away we go. Item number 3 on our agenda is concepts to be raised. In the hopes that we will have one motion, I am going to just read the titles of these concepts that we have to be raised, and we'll then take a motion. Item 1 is an act concerning the secured transmission of minor patient safety plans to schools by healthcare providers. Item 2 is an act concerning hospital sale leaseback agreements and attestations concerning lack of private equity control of a hospital and control of or interference with the professional judgment and clinical decisions of certain healthcare providers. Item 3 is an act requiring an evaluation of the appointment of a receiver to manage hospitals in financial distress. Item 4 is an act concerning the Department of Developmental Services recommendations for various revisions to developmental services statutes. Item 5 is an act concerning the Department of Developmental Services recommendations regarding revisions to the department's Independent Mortality Review Board and Fatality Review Board. Item 6 is an act concerning social work licensure. Item 7 is an act concerning emergency medical services response time transparency. Item 8 is an act to prevent accidental overdose deaths and improve access to treatment and recovery. Item 9 is an act concerning the use of funds in the tobacco settlement funds. Item 10, an act concerning internet gaming disorder, gambling risk, and behavioral health prevention. Item 11, an act concerning veterinary medicine. Item 12, an act concerning various revisions to the public health statutes. Item 13, an act concerning dental medicine. Item 14, an act requiring certain healthcare facilities to allow terminally ill patients to use medical marijuana. Item 15, an act concerning patient protections and standards of care at Connecticut Valley Hospital. Item 16, an act concerning nutrition and food-based interventions for patients with diabetes and congestive heart failure. Item 17, an act concerning cardiac screening and sudden cardiac arrest prevention for certain student athletes. And item 18, an act establishing a working group regarding endometriosis. May I have a motion?
So moved.
Moved by Senator Marks. Is there a second? Seconded by Representative Clara DeStitria. Is there discussion on the item? Representative Dauphiné.
Thank you, Madam Chair. And are we looking to put these all together and vote on them all at one time? Is that the idea?
We would hope to have a voice vote
Okay.
on a voice vote, not a roll call vote on these items, to just raise titles. And I would remind everyone, again, the public watching, what this does is allow us to have the titles raised, bills will be drafted, then we will have them heard in committee.
Thank you for that. I wanted to just explain further that we really don't know what these are about. They're concepts. While I generally don't like to vote on things I don't know what we're voting on, we are just voting on them to be heard. So I look forward to hearing what each one of these is particularly about. Thank you.
Absolutely. And I'm happy to give a quick update on each if that's something that the committee would prefer. We have I think we have screened these bills together. We do our screening process in joint fashion with our ranking members and come to consensus on the agenda. So if there are any specific questions about any of the items, many of these items are bills that we had before us previously last year that we will continue the conversation as we often do here. So if there are any specific questions, I'm happy to answer them. Representative Dauphiné.
Thank you, Madam Chair. I would just ask if you have anything that you can elaborate on any of them to do so. I mean, I'm sure that there's going to be many that I'm not going to like the content of, but if there's anything specific, I know we're under the gun with time here today, so, but if there's anything specific that you can add, that would be great.
Sure, I can go through in kind of a speed round and just give a tiny little bit of background. Item number 1, this was last year, House Bill 7158. This is about schools notifying, or patients and parents giving permission to notify schools about safety plans when there's been suicidal ideation of a young person. Item 2 is based on what we did here, Senate Bill 1507 last year. This was around private equity control of hospitals. We'll see similar language. Item 3, also last year, we had legislation that would allow us to discuss how we create a receivership process for hospitals in financial distress. Items 4 and 5 are their department recommendations that come to us from DDS. These are technical changes, and it's a cleanup of duplication efforts. In particular, for item 5, there was an executive order. They're looking to change that in statute, clean that up. Item 6 is related to the LMSW, the testing for social workers, and we sunsetted that. The date is January 1st, 2026, so we have an issue now we need to address. There's movement nationally to get rid of the licensure exam for LMSWs, of course keep it for LCSWs. Item 7, this one is going to allow us to gather information to access more data for our EMS, which we're seeing issues, especially in our rural areas, so we want to be able to gather some more information and data on that. Item 8 is, again, a bill familiar to this committee. This is a bill that Senator Amor has worked on for a long time about our overdose prevention center, so we'll see similar language to what we've seen last year. Item 9 is a perennial favorite here in public health, which is to assure that we recommend the fully recommended amount of use of tobacco settlement funds at $32+ million. And item 10, also similar to last year, this is an issue that continues to be a problem. We see gaming. Gaming is the official term for gambling, but we also are talking about what is happening with our young people with social media, internet, and games that they're playing online, not necessarily for money, but a precursor to gambling risk. Veterinary medicine is related to the fact that we don't have a veterinary school in the state and the ability to look at allowing those who are studying abroad to be able to have an easier pathway to be licensed here in the state. Various revisions to the public health statutes. We always have a bill that includes a number of items. This is almost always a bill that is a consensus bill with our ranking members. I know we have one item or two in particular. I don't remember actually which ones those are that were proposals that came to us that we have said we would include there. There will be others that would be added to that. So that one is not a set in stone at this point. And that concerning dental medicine, there are, again, a number of content areas that are coming from the Dental Association and the Oral Health Initiative. We have not finished our screening and meeting with those, so that one is a work in progress in terms of what exactly we'll put in a draft. It will be a fully drafted bill for hearing. The healthcare facilities to allow terminally ill patients to use medical marijuana, that one is as it says, and that is something that we want to just make sure we're not running into issues with what's allowed and not allowed state versus federal, and making sure people have access. Item 15, patient protections and standards of care at Connecticut Valley Hospital. Again, one that we heard before about making sure that patients are kept safe with one another, and that one comes from Senator Summers. The nutrition and food-based interventions for patients with diabetes and congestive heart failure. This is something that Senator Amor and Representative Foster has been working on this issue for years. We know that the Human Services Committee has done work on this, but also this is about working with hospitals and how we can assure that people have access to food which is obviously a really important piece of health for those with diabetes and congestive heart failure, and how that would be covered and paid for. The cardiac screening and sudden cardiac arrest prevention for certain student athletes, and looking to the two people to my right in particular, this is making sure that we're properly screening and assessing risk for certain student athletes. And then finally, an act establishing a working group regarding endometriosis. I want to thank, I'm looking at Rep. Gilchrist and Rep. Kennedy in particular, and others, forgive me if I'm forgetting who else has been involved in this effort. We're looking to actually put this in statute and codify this in a little more formal way. The ongoing work has been done, so it may sound like it's something new, but it's actually codifying something that we've been doing. Any further questions or comments? Representative Steinberg.
Thank you, Madam Chair. Are we to assume that this represents the full litany of bills, or there'll be another bill-raising session?
That is so wonderful that you asked that, Representative Steinberg. I love that. We continue to have bill requests come in. I think we have screening meetings scheduled through next week. Just to give folks, including members, a sense of the scope. I'm nearly certain there were well over 100 proposals at this point for bills, and that doesn't include what we know is coming from the governor's office. We have some pretty big items here at this committee this year, as I referenced before. We know we're going to be having conversations about the Office of Health Strategy, the private equity conversations, and we will be having a bill about vaccines. Those three issues alone could probably take us the full session without any other bills. So no, we will be raising other bills. I think we struggle at times because there are so many pressing health-related issues that come before us, but we will certainly be raising other concepts. I appreciate very much the opportunity to share that and to give that context. Any other questions or comments? So seeing none, we will take a vote, and I will note that we have a voice vote, so we will leave the meeting open for attendance purposes until the session begins, the House session begins at noon. We're unable to leave the meeting open any longer than that. So with no further discussion, all those in favor of raising these concepts, please signify by saying aye.
Aye.
Wonderful.
You want to sing a song?
And Representative Jenga, if you could mute yourself, that would be wonderful. And with that, I'm going to just make a couple other announcements of meeting dates and times. Our next committee meeting. Let's see, I think we're having a little bit of feedback. We'll just hang on one second. There we go. Wonderful. So committee members, you have received from Diane, our new clerk, a schedule that was attached to an email that you got yesterday. This was our committee meetings and our public hearing schedule. So our next committee meeting is scheduled for the 9th at noon, where we will be raising more titles, to Rep. Steinberg's point. And then the first hearing we have is, the first public hearing is scheduled for the 18th. So if folks can put those on your calendar, that would be great. Senator Anwar, Rep. Claridis-Deidre, anything before we recess? Nope. Okay, with that, we are in recess until noon. Thank you, everyone.
Hi, Representative Parker.
Can you hear me now?
I can hear you now.
Hi, Beth.
Hi.
Nice to see you.
You're marked present.
Thank you,
We're
ma'am.
recessed until session starts, so you're good.
Perfect. Thanks, Beth.
Thank you.
Nice to see you. Hey, Senator. Welcome, Diane. See ya. Bye.
Hi, Senator. I see you. You're all set. My Capitol office, Soward's office on the 5th floor. I'll get a room number for you guys. Yep, I will. Hi, Senator. How are you?
Hello there. Sorry, I could not get my sound to work on my computers.
Okay,
Phone's
you're
just
all
as
set.
good.
I have you.
Thank you.
You're welcome.
Have a great weekend.
Same to you. Bye.
Recording in progress.
Talk to you later.
All right, talk to you later.
Hi, Senator.
Hi. Hold on. Sorry. Okay, sorry. I
Okay.
just need to vote yes.
On yeah, okay. They were
Sorry.
all done together. So
Okay, great, perfect. Sorry, running between here and Approps.
that's okay.
Thank you. Bye.
Okay, see you later. Bye.
Hello? Hello?
Yes. Can't I
Hello?
just text her?
Hello?
Let me just text her. She's outside.
Diane?
Hi, Rep Zupkis. I have you for attendance.
Thank you. Was it voice votes, Bev?
Yes, ma'am.
Thank you. I appreciate it.
Okay, see you later.
Okay, thank you.
Bye.
Bye.
How are you?
Hello.
I'm here. I'm here. Hi, Senator Slap.
How are you?
I'm doing well. We're open until noon for attendance, so you're all set.
Okay, thank you very much.
You're welcome. Bye-bye.
Bye-bye.
Turn up volume. Let me see. Can you hear me? Okay. Just have to make sure my microphone is properly connected. I don't have. Testing. Testing. Seems to be fine now.
You're good for attendance, Doug. I can't hear you, Senator. You're all set, if you can hear me. Okay, no problem. Susan? Hi. Hey,
How are you?
doing well.
Good, good. Yeah, I'm just,
How are you?
I'm okay. Trying to get through everything, yeah.
It's a lot.
Yeah. Yeah, and all the, I mean, everything.
Everything is a lot.
I even trained a fuel cell / hydrogen group nationally,
You did? Okay.
you know. I better.
Pile it on.
You know what they just did? They just had a train collision with natural gas. In right in Mansfield next to it. They gotta, we have the technology to move away.
Things shouldn't be the way it is.
You got that right.
There's enough resources and we allow the corporations to take taxpayers' money and do shit most of the time.
That's. They're looking for the power and the money, so
Mhm.
they can get everything they can get out of this.
You know, I know.
Good to see you.
Good to see you too. Okay.
Morning. Happy Thursday. Thank you. Happy to give you a I wasn't you know that you're the first. Yeah. No, she knew, and she tried to bless us.
Hey, Dave, what's for lunch? I'm stressed. I want something dangerous.
Send the bills, Diane.
Okay. It takes a lot off me to having to keep checking.
They're coming in on. But yeah, they.
Diane, how many people we have leave to check in? How many more members we have to check in? Names, please. He checked in, yeah. Slap checked in. Yeah. And Martinez came in. Okay. All right. Bye. Did she come on Zoom? Senator Kushner, did she make it in? Where is Julie? Yes, is she in her office? Okay, tell her to hop onto Zoom right now. She got like no minutes. Okay, yep. Yep, bye-bye.
You see, this has been scheduled up to February 6th. Is this gonna continue getting scheduled, Bev?
You mean the other meetings?
Yeah,
But those are all meetings that we're gonna do on hearings, so you can put it on the schedule.
yeah. The reason I was holding up, you scheduled this already, you know? And it was
What
kind
were
of
those? What are those? Let me.
screening. It's a.
Yeah, you can take those off.
Yeah, so till up to through February 6th. You still working on scheduling the rest?
Yeah, no, they're scheduled. They're what we're gonna do. So put it on his calendar. That's what he and Kristen agreed to.
I just wanted to know hours, how much time I should allocate. It was convenient for me when these first three were done. I just accepted it and boom, it's on his calendar.
Okay. I'm not going to be doing all the Zoom stuff because things will change as we go along.
Mhm.
So for example, the sixth screening, we're doing 1:30. That is tomorrow. I would do 2 hours.
Okay,
The 9th at 12 noon, we can do like an hour and a half or less. It will take us maybe 15 minutes. So do like an hour and a half. So he's got some
Mhm.
time in case people bitch about the topics that are on there, the titles.
mm-hmm.
On the 11th,
On the 10th,
on the 10th is screening. I do 2 hours.
2 hours, okay.
Yeah.
Oh, really?
I got you. You just made it. You was on Zoom? They didn't catch you.
I wasn't.
Oh, okay. You're good.
February 11th?
That shouldn't be that long.
An hour?
I don't know what I have.
Okay. February 17th?
I would do like an hour and we shouldn't have much there at that time.
2 hours? 1.5?
I would do one and a half.
Okay. February 18th? Public hearing.
All
Oh,
day,
it's all day.
all day. And I can't tell you anything further. Race bill deadline is on the 20th. I would say public hearing on the 19th, I would do 2.5 hours for the 19th.
On the 19th, 2.5 hours?
Yeah, just to be safe.
Okay,
And on the 20th, I would do an hour and a half. It could be less, depends on where you're gonna JF bills.
public hearing is all day.
Yep,
The rest I have an idea.
all day, all night. And moving after the 20th of February,
Uh-huh.
most committee meetings will be a little long
Uh-huh,
because we're starting to JF stuff.
yeah, okay.
Yep.
That I have an idea, all right.
Dearly beloved, we gathered here today. I don't hear you.